canal in the middle and ischiorectal fossae on each side of the anal canal. Now, cutaneous innervation of the anal triangle. It is supplied by the inferior rectal nerve that arises from the S2, S3 and S4. It supplies the skin around the anus and over the ischiorectal fossa, inferior rectal nerve. Another is the perineal branch of the fourth sacral nerve. It supplies the skin posterior to the anus. This area it is supplied by the perineal branch of the fourth sacral nerve. Now anal canal is the last 4 centimeters of the gastrointestinal tract. It lies in the center of the anal triangle below the pelvic diaphragm and between the right and left ischiorectal fossae. These ischiorectal fossae allow the expansion of the anal canal during passage of the feces. Now ischiorectal fossae, these are also known as ischioanal fossae. The ischiorectal fossa is a wedge-shaped, fat-filled space situated on each side of the anal canal below the pelvic diaphragm. The two fossae communicate with each other behind the anal canal. They help in the dilatation of anal canal during defecation, the passage of flatus and feces. The base of the fossa lies on the skin over the anal region of the perineum and the apex is directed upwards and laterally. Each fossa measures about 5 centimeters in length, 5 centimeters in breadth and 5 centimeters in depth. You can see the coronal section through the ischiorectal fossa. Now boundaries of the ischiorectal fossa, it is bounded laterally by the fascia covering the obturator internus muscle. This is the obturator internus. Now this is the fascia covering the obturator internus and ischial tuberosity. Medially it is bounded by the fascia covering the levator ani muscle and the external anal sphincter. Now posteriorly lies the sacrotuberous ligament, posterior of which is the gluteus maximus muscle, and anteriorly we have the posterior border of the perineal membrane. Now floor of this ischiorectal fossa is formed by the perineal skin and the roof. This is the roof. It is formed by the meeting point of the fascia covering the obturator internus and the inferior fascia of the pelvic diaphragm. Sometimes there is a gap between the fascia covering the levator ani and the obturator fascia here, and this gap is known as hiatus of Scholbe. That may be the reason for the herniation of the pelvic viscera into the ischiorectal fossa. Now contents of the ischiorectal fossa. First is the ischiorectal pad of fat. Second, inferior rectal nerves and vessels running from the lateral to the medial side. Now another content is the perineal branch of fourth sacral nerve, which enters the posterior angle of the fossa running over levator ani to reach sphincter ani, which it innervates. So these are the contents, and the last content is the posterior sucrotal or posterior labial nerves and vessels, which cross the anterolateral part of the fossa to enter the urogenital triangle. So these were the contents of the ischiorectal fossa. Now clinical anatomy is sometimes there is abscess formation in the ischiorectal fossa. It is prone for infection due to its location. The infection may occur from boilers, abscess, abrasions of the perineal skin, from lesions within the anal canal, from pelvic infection. It often forms the abscess that is known as ischiorectal abscess. Now the fat in the ischiorectal fossa is loosely arranged, therefore swelling can occur without tension and with a little pain. The infection may readily pass from one fossa to the other through horse-shaped recess behind the anal canal, forming the horseshoe-shaped abscesses. Since the ischiorectal fossa does not contain any important structure, it can be incised to drain the abscess without any fear. In the neglected cases, the abscess may burst into the anal canal. It may burst into the anal canal or on the surface of the perineum to form the ischiorectal type of anorectal fistula or fistula in ano. Now pudendal canal. Pudendal canal, it is a facial canal present in the lateral wall of the ischiorectal fossa. Its another name is Alcock's canal. It is about 1 inch above the ischial tuberosity. It extends from the lesser sciatic foramen to the posterior limit of the deep perineal pouch. The pudendal canal is formed by the splitting of the obturator fascia. Now the contents of this pudendal canal are the pudendal nerve, which divides within the canal into the dorsal nerve of penis and perineal nerve, and another content is the internal pudendal vessels. Now the pudendal nerve provides the principal innervation to the perineum, hence it is designated as the chief nerve of the perineum. It arises from the ventral rami of S2, S3 and S4 in the pelvis. It leaves the pelvis through the greater sciatic foramina below the piriformis and medial to the internal pudendal vessels. It crosses the dorsum of the ischial spine and immediately disappears through the lesser sciatic foramen to enter the pudendal canal or Alcock's canal, which is present in the lateral wall of the ischiorectal fossa. In the posterior part of the canal, it gives off the inferior rectal nerve. This is the inferior rectal nerve given in the posterior part of the canal, which crosses the fossa to innervate the external anal sphincter, perianal skin, and then divides into terminal branches, a large perineal nerve and a small dorsal nerve of penis. The perineal nerve bifurcates almost at once. Its deeper branch supplies the sphincter, urethra and other muscles of the urogenital triangle. Superficial and deep transverse perineal nerves, ischiocavernosus and bulbospongiosus. Its superficial branch, this is the superficial branch, innervates the posterior 2/3 of the scrotum or labium majus as the posterior scrotal or labial nerves. The dorsal nerve of the penis or clitoris traverses the deep perineal pouch, then it passes through a gap between the arcuate pubic ligament and transverse perineal ligaments to reach the dorsum of the penis, where it innervates the skin of the body and glands of the penis. So this was about the pudendal nerve. Now what is pudendal nerve block? The pudendal nerve is infiltrated with a local anesthetic where it crosses the ischial spine. The ischial spine is palpated through the vagina. A long needle is inserted through the vaginal wall and guided by a finger to the ischial spine. The needle can also be inserted through the skin of the perineum. When the pudendal nerve blocks bilaterally, there is a loss of anal reflex, which is a useful test to know that a successful block is achieved. There is also relaxation of the pelvic floor muscles, loss of sensation to the vulva and lower third of the vagina. Now, internal pudendal artery. It is one of the two terminal branches of the anterior division of the internal iliac artery. It leaves the pelvis through the greater sciatic foramina below the piriformis. It crosses the dorsal surface of the ischial spine and enters the perineum through the lesser sciatic foramen, where it passes through the pudendal canal in the lateral wall of the ischiorectal fossa. Now it is branches. First branch is the inferior rectal nerve, arises in the pudendal canal, accompanies the inferior rectal nerve, and traverses across the ischiorectal fossa to supply the structures in the perineal region, perianal region. Another branch is the perineal branch. It arises in the anterior part of the canal, pierces the perineal membrane to enter the superficial perineal pouch, where it divides into transverse perineal artery and two posterior scrotal or labial arteries. Posterior scrotal or posterior labial arteries. Now, another branch is the artery to the bulb of the penis and urethra. It arises in the deep perineal pouch, pierces the perineal membrane and supplies the erectile tissue of the bulb of the penis in the male or the bulbs of the vestibule of vagina in female. It also supplies the urethra in both sexes. Another branch is the deep artery of the penis or clitoris, which pierces the perineal membrane and supplies the erectile tissue corpora cavernosa. Last branch is the dorsal artery of the penis or clitoris. It pierces the perineal membrane, passes upwards between the crura of penis or clitoris, and runs on the dorsal surface of the penis or clitoris beneath the fascia of penis or buccal fascia. It supplies the prepuce and glans of the penis. So these were the branches of the internal pudendal artery. This Alcock's canal or pudendal canal is very important in view of examination point of view. Thank you.